Hi, I'm Rickie Lee Ryan, and I'm the owner of Microcurrent for Kids. Um, I first had this company as a for profit organization that at the beginning of 2020, I converted it into a nonprofit organization. And so, what we do is work with children with special needs, most likely autism and ADHD and other learning disorders. So, microcurrent therapy is an electric based therapy where you actually apply little electrodes to the scalp and it sends very gentle, small current to the brain and the central nervous system. Microcurrent therapy is really for everyone, but Microcurrent for Kids is a program specifically designed to support children with special needs like autism and ADHD and other learning disorders. So, microcurrent is an excellent option for parents who are looking for support with their child's attention. And so, I see a lot of students or children that struggle with this regardless of what kind of diagnosis they have, even if they don't have a diagnosis per se. And the reason microcurrent is effective for this is because of the brainwave repatterning that often is a result of this therapy. So if you can think about your child who has an attention difficulty, if it's there's usually, there's a group that's very hyper that can't seem to sit still or look at something or attend for very long because they're too busy, and their body or, whatever is not, you know, they're not able to like calm and center and be present and focused. And so that's one thing that microcurrent can really help is train the brain to be able to spend time in that wavelength, which is called alpha. So being in a calm, present, open state is associated with the alpha brain wavelengths, and that is the best place for anyone to learn, child, adult, otherwise. That is when you're kind of like a sponge and ready to absorb what's in front of you. So I have a lot of families that come in quite frustrated because all the methods that they're using are not really working for their child. Whether that's all the different interventions from occupational therapists or educational specialists and whatnot. And really, microcurrent is working internally, right with the brain and the central nervous system and everything else that it connects to and that's going on inside these little bodies. I often explain it to parents, if you have something bothering you physically, whether it's a really bad stress tension in your neck and shoulders or something, how easy is that for you to sit and do your work? This may not be pain, but it may be something else that your child's experiencing physically that is making it hard for them to center and calm and be ready to learn and pay attention. And so that can look like sensory overload or sensory seeking. Sometimes it's numbness or tingling or a feeling of floating, that children are jumping or moving or banging or squeezing or whatever to try to get that feedback in order to feel just normal, like so it's you really kind of have to look and see what behaviors the children are exhibiting, because there's always a reason generally behind that behavior. There is a need that behavior is fulfilling, and by organizing the sensory processing of the central nervous system and the peripheral nervous system, you're just so much better prepared to pay attention. And that is what microcurrent therapy can do. So I always encourage families to have concurrent therapies going on, at least with whatever their prime concern is, because microcurrent, really helps regulate and stabilize the central nervous system and, the rest of, things going on inside the body that, really help with being able to be calm and present and attend. And that is the key to learning. If you're, present and available, you're ready to learn. And so whatever the major concern is, I always encourage families to have, if it's speech, or reading, or, whatever that is, that there's, also therapy going on alongside that, because microcurrent's not going to change the behaviors or, teach a new behavior. It's just going to prepare the child and to be ready to learn. And so that, really just kind of creates this, kind of cleans the canvas, I guess, if you will, or opens the door, however you want to look at it, to, being ready to learn. And so whatever that is, whether it's, something that's a physical situation that's going on. I've had a lot of fine motor improvements, or, speech or attention, or even social awareness and, picking up on cues that they've never picked up on before, and, being interested in, that kind of thing. So we always encourage concurrent therapies.